Pepfar. Saving lives. Investing in people. Pepfar. Partnering for an AIDS-free generation.
10 years ago, AIDS was a death sentence, stalling economic development, targeting youth in their prime, threatening the security of millions.
We were in the midst of the period of denialism in South Africa. We were working very hard against an administration that was pushing back. And then Durban 2000 highlighted this difference between the North having antivirals and the South dying of AIDS.
Most distressing was the fact that by that time, there were some drugs appearing in the developed world. AZT was the first, and then there was a sequence of drugs. So we knew that there were drugs available which could treat these infected children. And we just had no access to them.
In 2003, the United States launched the President's Emergency Plan for AIDS Relief, Pepfar. The story of Pepfar in South Africa begins as an emergency response to a devastating epidemic that was sweeping through the country.
Many people would agree that George Bush was really very visionary. Unlike anything that probably had ever been done before in terms of international global health contributions, Pepfar was this. Pepfar saved hundreds of thousands of lives.
This comprehensive plan will prevent 7 million new AIDS infections, treat at least 2 million people with life-extending drugs, and provide humane care for millions of people suffering from AIDS and for children orphaned by AIDS.
Pepfar was given the head start it needed to provide support and expand existing platforms and programs.
Kudos to the American people. They stepped in when we had people dying in queues. They helped us save literally millions of South Africans.
The difference is visible every day on the streets of South Africa. Hundreds of thousands of people have had their health restored, like my health. After 17 years, I live a full and vigorous and active life because of antiretroviral treatment. My treatment is paid for by my medical insurance, but for many millions of other people, it's Pepfar money that has made that difference.
Pepfar has invested $4.2 billion over the past decade in prevention, treatment, and care for those with HIV/AIDS, and to increasingly strengthen the country's health system. Pepfar represents the largest foreign assistance initiative by any nation in history to combat a single disease. U.S. investment increased to over $500 million between 2008 and 2011. As the South African government increasingly funds and manages the HIV response, Pepfar funding is planned to gradually decrease. Working towards the goal of an AIDS-free generation has led to the following achievements. More than 2.4 million HIV-positive individuals on ARVs. Reduction of mother-to-child transmission down to less than 3%. More than 38 million individuals received HIV counseling and testing. Over 624,000 men circumcised as part of prevention. More than 477,000 orphans and vulnerable children receiving care services. Pepfar's early response to the crisis in South Africa was the catalyst that sparked the rollout of hundreds of projects and programs throughout the country with strategic partners. What started out as a critical intervention steeped in compassionate action today leaves a legacy of cooperation, collaboration, and sustainability. The impact of Pepfar is a lasting legacy that leaves a strengthened health system and broadening access to health care, with HIV/AIDS a manageable chronic disease.
It was an extraordinary initiative, and it suddenly made possible what people had thought was impossible to do.
The United States of America will remain the global leader in the fight against HIV and AIDS. We will stand with you every step of this journey until we reach the day that we know is possible, when all men and women can protect themselves from infection, a day when all people with HIV have access to the treatments that extend their lives, the day when there are no babies being born with HIV or AIDS, and when we achieve at long last what was once hard to imagine, and that's an AIDS-free generation.
I don't think we'll have arrived here where we are without Pepfar. At the moment, we are tipping the scales. We are not claiming by any means that the HIV pandemic is over in South Africa. We still have a long period to fight, but we have turned the corner.
The prevention of mother-to-child transmission, PMTCT, is by far the greatest success story to date in South Africa's fight against the HIV/AIDS epidemic.
I remember that most women who came to the clinic who were diagnosed with HIV and their children being diagnosed of HIV, there was nothing for them. All that we saw was women crying and losing their children and people dying all the time.
The overwhelming majority of HIV came from the mothers. It came in the womb. It came in that sort of bloody pool during delivery, and it came through breastfeeding. So it was to try and tackle those sites of transmission.
We started to first test and counsel. We couldn't do anything else at that time. There was no treatment. There were no prevention modalities. We started to work on strategies to stop mother-to-child transmission.
Early testing of ARVs started in the Western Cape in 1999. It was only in 2003 that these life-saving drugs became available legally and nationally. Although death was inevitable for the mothers, they were given the opportunity to save their babies.
When we finally started to be able to provide antiretrovirals to prevent mother-to-child transmission, that was a victory that came through court cases and lots of activism, but it started to change people's lives in a way that I think we didn't imagine at the time. When we started to roll out antiretroviral therapy, and we were one of the first places to do that in Soweto, and we started to see how these drugs changed people's lives, changed families' lives, changed communities' lives, and realized that we were going to have enough support through Pepfar and through other donor money to roll this out.
For me, it's amazing that research had found out that if you're positive, you could test in time and access medication. And I received those medications and the counseling and the education on how to prevent mother-to-child transmission.
Very, very few women were testing for HIV. If you don't know you're HIV positive, why are you going to take anything to reduce transmission to your baby? So then we improved the diagnostics, and I mean, through the country now, our testing rates are in excess of 96%. Most women are testing for HIV in pregnancy.
We were able to stop vertical transmission with the use of antiretrovirals at key moments during a woman's own interaction with her virus. And I think that has again been really very important.
Nonyebo Jabari lives with her husband Jacob in Attridgeville, a township on the outskirts of Pretoria. Both Nonyebo and Jacob are living with HIV and have 3 healthy HIV-free children.
Ndayazi ukuthi ndine HIV ngefirstborn yami ngo-2009 and then ndihambe treatment nge ndaqale ama-ARVs khona apho ndadla ithe ndombeleka ndafumana ukuthi unegative ke ngoku ndarelax emoyeni.
I have a 7-year-old who's turning 8 this year, who's tested HIV negative, and I also have a 3-year-old that has tested negative. And you won't believe the relief I have, because today I know that when my kids are coughing, it's not because they have HIV. There could be other things like TB, but of course I'll go and consult, and I won't have sleepless nights thinking that my baby is going to die, which is what happened to my daughter Nomtunzi.
Yeah, ithe ndigqiba kuba belekene bayinika ama-nevirapine abo ukuthi ndibaseze for 6 months. Yeah, and ithe bayocheka futhi bafikele ukuthi be-negative banankinga.
The joy and pride that the kids are giving me is amazing, and to know that I can wake up every day and be given a chance to look after them, because I'm receiving ARVs that were funded by Pepfar, and because the medication that Pepfar gave saved my 2 children, has even given me more strength to try other things like studying at university, but also working more with women all over the world.
I saw HIV explode in front of me, particularly in the pediatric wards. And in 10 years, with the rollout of interventions to prevent mother-to-child transmission, I came full circle and see a country and see a community that has managed to control HIV. And a particular achievement because of a bilateral agreement that revolutionized the care of children and helped put our infant mortality rate back onto a respectable level.
They came in trickles, 1 by 1, 10 by 10, and very soon our wards, which never had HIV before, were overwhelmed with children who had HIV. It's something you couldn't escape. It was so sudden, stark, and dramatic that it sort of hit you between the eyes.
Mase ngizwile ukuthi ngipositive. Kwababhlungu ngoba bengumuntu obenakho ukuthi ahlale a-test ngumuntu ongajwayelanga ukuba ne-boyfriend. Kwababhlungu kodwa ngathi baningi bayaphila.
I was diagnosed in 2005 when I was pregnant, my little one, that 9-year-old. So I go to the clinic, they test me, they told me about the results. I was a little bit shocked, but I thought that there are many people that having this.
Through the support and commitment of Pepfar and its partners, the reality of an AIDS-free generation was made possible for the children of mothers like Sizeka and Zama.
We haven't conquered the epidemic in the mothers, but we've conquered that transmission to the babies. It's quite a phenomenal success.
When we started, we were looking at about 70,000 children infected, and it's come down steadily. In 2008, I think we're sitting, and that's about a 20% transmission. In 2008, we were sitting at about 8% transmission, and today we're sitting at 6 weeks at about a 2.5% transmission. So we now have about 7,000 children being infected, between 6,000 and 7,000 children infected in a year. So there's still transmissions, but it's a massive decline compared to what it was before.
There has never been, either in the history of the world, and certainly not in this country, an epidemic as severe, as devastating, and as persistent as the HIV epidemic. Within South Africa, we are the worst affected province, that is KwaZulu-Natal.
The challenge that you are currently facing is, in terms of HIV, is in the feeding practices, because although by the time they are 6 weeks they are HIV negative, we still have to make sure that the mothers are able to feed their children appropriately.
If you stop breastfeeding, you remove that prevention. They get malnourished, they get diarrhea, and they get pneumonia. So we couldn't stop breastfeeding. The Pepfar program was quite crucial. It really made it very much easier for us to not haggle or hassle about the drugs. We got the drugs, which was the main cost. We were able to set up the clinics. We were able to get the staff and to implement, with those Pepfar funds, a solid program for treatment of adults first and then children.
Yes, we've got a lot of mothers who come back to say they are happy, their children are negative. Sometimes you even meet them on the road, not specifically coming here. When you're on the road, the mother will be coming to, "Hi, Sister Rose, can you see, yes, your baby, the baby's fine." It's just so overwhelming. It's very nice to see that we are contributing a lot to our community.
It was almost miraculous to be able to take someone who didn't have access to treatment, who was dying, put them on drugs and see them get better and to become a healthy, fully contributing member of society once more. And very miraculous to see children who were mostly dying under 2 years of age to sit up and smile and, as you say, and become naughty. You know, wonderful. Nothing like it.
Over 5,000 new HIV infections occur every week in young women in 14 African countries. Nearly half of those new infections are in South Africa alone. The South African government and Pepfar continue to partner to address sexual and gender-based violence in order to reduce infections in young women.
People who are or who experience abuse as young kids are more likely to have multiple partners and more likely to engage in unsafe sexual practices. And a lot of that has to do with issues around self-esteem and dignity, because obviously abuse takes that away from a lot of people.
I used to beat up my wife. I beat her up for my own infidelities. I beat her up for my own insecurities. I would say, I want to beat you so hard that you scream, you cry, louder than my mom. I wanted her to love me. But how can you say that someone loves you when they are afraid of you?
Brothers for Life was created to assist with the strategic communication needed in response to the HIV/AIDS epidemic in South Africa. Their provocative engagement offers guidance aimed at reducing the high rate of sexual violence in the country.
The research we've got shows a lot of men saying how when they saw the ad, it touched back into their own childhood.
HIV and AIDS are interrelated. They are married with gender violence. If you are an abusive husband or a man, it is very likely that you're going to transmit, because you use violence to shut this woman's mouth so she doesn't ask you to account for your whereabouts or your shenanigans, your polygamous life. You use violence to shut her up.
Today we are getting abantu abarapa abantu besifazane. Today we are getting people abaraping ngane. They are destroying the families. They are destroying the communities. And really, as a royal family, we don't support that.
Pepfar supports Global Girl Media, which gives a voice to young women living with HIV/AIDS.
We launched in South Africa with 20 girls, and then we expanded. We also launched simultaneously in Los Angeles. So the concept is that there is a bureau, a news bureau, of girls in a developing country. At the same time, there's one being developed in America or Europe, and they get to know each other online, and they encourage each other as they're going through the same curriculum. And then they blog and Skype together, and we create Facebook events and Google Hangouts and things for them to know each other.
I was also chosen to be part of the World AIDS Conference that took place in Washington, D.C. in 2012. We covered the World AIDS Conference as the young journalists living with HIV and AIDS.
Mandisa's story is one of the many vehicles used to reclaim women's dignity and rights.
I kicked, screamed, cried, but nobody here. He had all the power to do what he wanted to do. I was only 6 years old.
Pepfar's priority has always been to reduce the vulnerability of young women and children to infections like HIV and AIDS. Through Tutuzela centers, USAID and Pepfar partner with government to ensure medical and legal support for victims within a state-run hospital. Tutuzela, a Xhosa word meaning comfort, offers a caring and supportive environment, turning victims into survivors.
You know, one of the biggest challenges in South Africa is what is called sexual violence. We had to look into how is the system dealing with those that are victimized, victims of rape or even attempted rapes. We had to come up with a mechanism that would be able to deal with that. So that those are the challenges that came, you know, to bring Tutuzela to the fore.
All the preparation here is to get all the evidence together so that at the end of the day, when the case goes to court, you know, all the information and all the evidence is there. And then we've got what we call here the crime kits. Now, the crime kits are the DNA kits that are supplied by the police. As you can see, this one is an adult sexual assault evidence kit, and we also got the children's kits here for the little ones. If a child, for instance, you will ask the child, were you raped? And the child will say, no, I wasn't raped, but he put something into me. And then they'll be given the doll, and the child will show that this is what was put here. And then that's how actually they will write the statements, and the court accepts this.
We have had more than 150 life imprisonments, for instance, during this time. And it is quite an achievement because we used to have very, very flimsy sentences around rape. Certainly from the Thuthuzela care centers, we are more geared to being able to service the nation because we have, over the years that we have partnered with Pepfar, been able to shape the program so that it gives the best possible treatment that it can give to victims of sexual violence.
Out of the 52 Thuthuzela care centers that exist across the country, there are more than 30,000 victims every year receiving treatment. In partnership with MacAIDS, Pepfar supports the South African government in expanding this model to a number of African countries. Ingenuity is key in sustaining the fight against HIV/AIDS. Pepfar and the South African government partner to find innovative ways to manage the epidemic.
When we first started treatment, people were being brought in wheelbarrows, carried, and they were really, really sick and dying. And the treatment just transformed that, and that's through the Pepfar funding. So two big challenges that face us is how do we reduce infection in young women? How do we integrate HIV/TB services?
So one of the things that we have taken to heart in trying to understand the HIV epidemic is to understand the dual challenges of providing treatment and prevention. We've been able to do that very successfully with Pepfar, to the point where South Africa now has the largest AIDS treatment program in the world, treating at present in excess of 2.5 million people on antiretrovirals.
As the HIV epidemic was advancing and maturing, there was an increase in the number of tuberculosis patients. The Ministry of Health launched a solution for earlier detection of TB, the Gene Expert machine. Right to Care was one of the many Pepfar partners that supported the rollout.
We're the first country in the world to switch from the old Koch smear, the Aspergillus bacilli, to Gene Expert, and that transition is complete. And so every South African now has access to Gene Expert diagnosis, which has led to better, improved, more rapid diagnosis and early recognition of drug resistance.
If you initiate antiretroviral treatment early during tuberculosis, we can reduce the death rate by 56%. If we just implemented our findings in South Africa alone, we would avert about 10,000 deaths a year. That's the kind of impact this research has made.
We actually provided the Department of Health with the strategic plan for HIV treatment going forward. That changed the treatment guidelines and accessed ever-increasing amounts of funding that will eventually target about 4.2 million patients on treatment.
The next innovation to strengthen the healthcare system not only challenged waiting times, but also allowed pharmacists time to interact with patients.
Our pharmacy automation plan has really crystallized out through the initiative of a number of individuals. I had challenged the team to say that the waiting times in the clinic all surround the pharmacy.
When I first started working here, we used to see about 800 patients a day. Those patients would queue from as early as 3 a.m. And by 8 o'clock, I'll still be down there trying to finish those patients, and it was not possible. Some would have to go home without that medication, unfortunately. But once the machine was installed, then things were even way better. The machine actually brought a whole new dynamics to pharmacy.
It also has reduced the cost of prescription. We actually have a cost reduction to about half the amount of money per script dispensed, and we've eliminated stock losses and expiring medication. So now the script is in the cloud. The patient can go anywhere within our network and they can receive a script based on a chip card and draw down their medicine dispensing. So these are very exciting developments, but novel, but new, certainly innovative.
If Pepfar didn't give me this funding that I have, I wouldn't be able to actually have the impact that I have in patients' lives.
An AIDS-free generation is achievable, but it's not achievable soon. It is something we have to look to as a long-term goal. We have many approaches and many technologies that we can use to take us down the path of steadily diminishing the impact of HIV.
Children affected by parents dying of HIV/AIDS had to be taken into care. Some were born HIV positive themselves and were vulnerable. Centers like Nazareth House were established to protect and care for these children.
The first year that we took HIV positive children into Nazareth House, the first year we had about 4, and then the following year we had 10, and the numbers just escalated until by 1996-97 we had 60 babies and very young children, all under the age of 5, all HIV infected, and most of them had full-blown AIDS and were very, very sick. And during that time we lost almost 90 little ones. The only response we had really were antibiotics, vitamins, and, Panado really just for the pain. Although later on, fortunately, they did start giving them morphine when they were really at the last stages. Every time they developed a sickness, if they got pneumonia or they developed gastro or anything, straight away we would think, oh, is this the end now? It was just a very unsettling and uncertain time. And yet you had to be positive all the time for the children's sake and keep giving them hope all the time, whereas we had very little hope really because we just didn't know what the future was going to be. And the doctors kept warning us, they will not live beyond the age of 5 years, so don't expect them to.
With the advent of ARV treatment, the children's destinies were set to change.
I remember clearly about 6 months after we put the children on treatment, one of the nuns came to me and she said to me, she doesn't know what this medication is doing to the children because they are so boisterous and rowdy and behaving so badly. So we said to her sister, they are just behaving like normal kids now. They are healthy, they are not terminally sick anymore. They had to make considerable changes because the children now were not dying at the age of 5 or 6 anymore. 10 years down the line, we have Nazareth House children that were started on ARVs in 2004, 2005, who are finishing high school now.
The majority of them really kind of turned a corner and really started flourishing. And most of those children now are in their 20s, their early 20s, and it's wonderful. They're living healthy, normal, active lives.
Isibindi is another effective model created by the National Association of Children and Youth Care Workers that supports orphans and vulnerable children.
Isibindi is a Zulu word meaning courage, and the model creates circles of care around children. The idea is that we recruit unemployed women and men in rural communities, train them to work with vulnerable children and families.
I can say, without the activities that I took part in at Isibindi, maybe I wouldn't be here.
We designed and created the Isibindi model as an early intervention and prevention program where we would develop child and youth care workers with capacity and skills right there in rural communities responding to the HIV/AIDS crisis.
Sibonello is a youth care worker trained by the NACCW. He now mentors and supports Isibindi youth like Owen Mafalika.
The communities that we have to work in are communities that are actually rural. They are rural, so most of the families don't have anything. The families don't have anything. So what we do is that we go into these families and try to offer them resources that will help them to be something in life.
In South Africa, we have what is called the youth bulge. So statistically, we're a large children-youth population. So it's important for us to emphasize the development of workers who respond effectively to the needs of children and youth.
I still had memories of my dreams I usually discussed with my mother because she was more closer to me. So I usually shared my dreams with her. So the time she was gone, I had nobody to discuss my dreams with. Without the ECBND program, I don't think I would have made it.
Strengthening child welfare and protection systems is a central focus for Pepfar, and its funding has enabled the ECBND model to respond effectively to children in unique circumstances.
We've developed the concept of safe park, places for children to play, to recognize children's rights to play in contexts where there are no playgrounds, there are no parks.
My responsibility is to teach the youth that is growing up disadvantagedly. I want to teach them how life is, share them my story, tell them how it feels when you go to university, how it feels when you don't have financial help, when you don't have money to study, and how ECBND works. And then I want to encourage them to study, show them the advantages of having a certain achievement, whereby that will open doors for you in the future.
In partnership with government and Pepfar, the Minister is expecting to see 400 ECBND projects servicing 1.4 million children and developing 10,000 child and youth care workers in rural communities scattered throughout South Africa.
Since 2004, Pepfar funding has contributed to HIV counseling and testing of over 38 million individuals across the country's urban and rural areas. The Desmond Tutu TB Center through Stellenbosch University runs a number of visible community outreach programs aimed at HIV prevention and testing in the Western Cape.
So the mobile sites are able to access a lot of opportunistic clients. So those are clients who woke up in the morning who weren't thinking about getting an HIV test. They walk down the street, they pass our tents and our caravan, and they decide, what a great idea, let's go in and either have an HIV test or get our blood pressure checked. So we access a very well population, people that aren't feeling sick at the time, and we're able to provide then early diagnosis and linkage to care for those people.
Normally we should someone go and doing testing alone, but today I think it's a good idea to come and doing it together, and then it will bring more trust to each other as it will build up more. So I think that's a good idea. I don't know about you, but I know you.
I wasn't expecting that she will call me for this party. It really shows me how much she loves me, and the way she involved me on all this testing, it really shows me that she's a caring person, and I'm happy for this. We tested for everything, because here they do testing for the blood sugar, yes, blood pressure, HIV and testing and TB. So we just think of doing it one all.
Family Matters is a community counseling project that provides a creche, a craft center, and a family counseling program. This program targets 9 to 12-year-olds and is aimed at empowering parents to better communicate information on delaying sexual activity.
Our primary objective is to ensure that we try and promote positive parenting practices. By so doing, the important thing is to ensure effective communication between parents and their kids. Out of the studies that have been done, we've seen that when parents communicate with their young ones, especially on matters of sexuality and reproductive health, these actually go a long way in ensuring that they cut down on prevalences of HIV and AIDS, on STIs, and teenage pregnancy.
The Family Matters program in Orange Farm near Johannesburg proves as effective.
So that we understand ukuthi esigabeni sokuba ukusuka from umntana ukuya teenager then uba umama uhamba kanjani neindlela ahlangane nazo ekukuthi nami ngisazohlangana nazo ukuthi mase ngifika lapho ngavesane ngicakeke ngazi ukuthi umama ngixwayisile.
Mina noZandile sesiclose kakhulu manje ngoba kunezinto ebengifisa ukukhuluma ngaye nazo empilweni but bengakhoni uyabona bengisaba neminye imibuzo bekangibuza like bengimthethisa uyabo but since ngihamba isikolo lesi sengiyakwazi ukuhlala naye phansi ngimamele angibuze ngimphendule like sese understand now
TB HIV Care Association has established a number of support programs and services. Among these is supporting vulnerable and underserved groups, including sex workers and men who have sex with men.
Our organization, TB HIV Care Association, has been very involved in supporting government programs. That means from the point of prevention to, if people get infected, diagnosing them, linking them into care. Once they're on treatment, keeping them on treatment.
We have a mobile van, which consists of a driver, a professional nurse, a counselor, and 4 peer educators, whom were sex workers. And we go to the places where our sex workers are active. We go to brothels, we go to the streets, and we render a service by giving them HIV testing, TB screenings, as well as STI screenings.
I believe my health is more important. I learned this by the sisters on the van. If it hadn't to be for them, I wouldn't still be in these dark ages.
20% of new infections in South Africa are among sex workers or their clients or their partners.
Where access to healthcare services is limited, Pepfar has partnered to strengthen organizations already working in rural and underserviced communities, like the Breede River Hospice mobile clinics in Worcester.
So sienplakkerskamp. Nee, dit is baie fair vir die mense. En baie van die mense wil nie lank gaan sit by die kliniekie. Baie van die mense draai om. En dis hoekom ons gevoel het die karavaan was 'n baie goeie ding.
Toen ik had van hier maar wat maken met die karavaan. Toen ik aan die karavaan komen, de mensen van TB toetsen, Fox toetsen daar zo. Maar toen zei ik maar ik wil ook daar zo, als ik wil gaan.
Thanks to the mobile clinic visiting his community on a regular basis, Darius is now receiving TB treatment. With outreach provided by Pepfar support across the country, vulnerable and underserviced communities have access to testing and counseling. With millions of people on treatment, the country still faced the challenge of reducing new infections. Although voluntary medical male circumcision doesn't prevent HIV, it reduces the risk of female-to-male sexual transmission by approximately 60%.
Treatment alone is not enough to be able to prevent new infections. There had to be other methods that are brought into the picture.
In 2007, UNAIDS and WHO resolved that medical male circumcision was proven beyond doubt to have a protective effect, and Pepfar was a very important part of this process.
The Center for HIV and AIDS Prevention Studies was originally formed as an organization that was going to roll out medical male circumcision for HIV prevention. Since the National Department of Health and the President themselves declared circumcision a priority area for the country.
Introducing voluntary MMC in a country where circumcision is traditionally a rite of passage, the government and medical community had a challenge before them.
People still believe that I have to go to the mountain because my dad, my grand, and my other grands, they're from the mountain. The perception is that you have men if you go to the hospital.
Should maybe siko lama livumo. Yabo kube ngoba melivumo isiko lama believe ukuthi mengiyoze ngibe kule age engikuyo ngingakasecircumcise. Yabo. So kushuthi isiko lami alihambelani. So that's why ngicine ngidecide ukuza ngizobona ukuthi kuyenzakalani.
In partnership with Pepfar, King Goodwill's Welitini of the Royal Bayete Trust ended nearly 2 centuries of tradition by declaring that all Zulu men and youth should be circumcised medically.
Into engenza ngidecide ukuthi ngize is because ukureduce ama-illness afana nabo-STI nama-HIV and AIDS.
Isilo, that's why sa-introduce indaba ukuthi indaba ye-male medical circumcision ukuthi akusokwe ngokwesilungu ukuze singabi nabantu abazoshona ekugcineni. So njengamanje sesi-circumcise sesisuka abafana abesilisa aba-more than 300,000. That shows ukuthi isintu esifakwa isilo sihlanganise nesilungu then kusebenza ndawonye.
The King's program has been highly successful because of the partnership between the local Department of Health, government, traditional leaders, and NGOs like Brothers for Life, who help mobilize young men with information.
My name is Lucas Mkwanazi, but popularly known as Tonic. Today is a big day for me. I decided to go and get circumcised. I did never say, but I have to do so. Wow, no pain at all. You know, for all those who are afraid, I'll tell you, it's not a big deal. No sex for 6 weeks, but it will be worth it. This is the best decision I've ever made, not only for me, but also for the people I love.
Feda nama out nyawakhuthaza ukuthi amanye nawo yabo angenelele ukuthi manje angazozithola bambe nje lokugula kwalabantwana bala estradini yabo.
Circumcision is a once-off procedure where the patient will come back once or twice for a checkup. So we have realized that we have a responsibility to keep going back to the communities where we have circumcised, keep giving the information about continuous prevention methods.
Ngithi ngabatshela abanye abafowethu ukuthi hayi bangayenza lento engiyenzile into right nami ngisithathile i-steps sokuqala nabo kumele bathathe i-steps sokuqala ukuze bazoba sharp nabo.
Since the launch of the circumcision drive in 2010, Pepfar has conducted more than 500,000 medical male circumcisions. Pepfar's total funding support for voluntary medical male circumcision since 2010 is $210 million. The funding is in support of the South African government's national goal of circumcising 4.3 million men by 2016. There are estimated to be more than 350,000 traditional health practitioners in South Africa. That's almost 9 times the number of medical doctors, making them more accessible to the population.
80% of the population uses the traditional medicine. The traditional practitioners, they live with the people, so their access is much easier than going to the health facilities.
At the beginning, Pepfar was just a monster of the scientists who were coming into our country to come and steal our knowledge. The Western healthcare system was not planned to work with traditional healers.
Programs around treatment, HIV awareness, tended to focus largely on the biomedical community, the doctors, nurses, pharmacists.
When the HIV/AIDS pandemic started, the major challenge that we're facing as traditional healers is that people were not accepting it.
The partnership between traditional leaders, traditional healers, the CDC, and Pepfar has saved many lives. This 5-year cutting-edge project focused on local-level collaboration between clinics and traditional healers.
Pepfar came in to assist to get the traditional healers as well as the Western healthcare system to work together.
We had an opportune moment when we got funding through Pepfar to improve the relationship of a referral between the two systems. In terms of strengthening the primary healthcare system, that's very important.
This partnership became a true model that will contribute to the development of traditional healthcare knowledge without compromising intellectual property rights of the healers.
In our African culture, if somebody is sick, we believe that that sickness is caused by something else. It can be caused by the ancestors. It can be caused by the neighbors, the friends.
We're getting media reports that traditional healers were spreading myths about HIV/AIDS. We recorded traditional healers on their own voices saying, this is a myth themselves with a face. You cannot sleep with a virgin to get rid of HIV, which was very powerful.
We started the training to educate the traditional healers about the virus itself so that they understand the virus. They understand the symptoms of the person who is HIV positive. It is difficult for us to diagnose HIV positive. If you suspect then this patient is HIV positive, then refer that patient. It's either to the clinic or to the hospital.
When we got the traditional healers to work with us around HIV and AIDS, for them to work with us in a clinic and for them to be able to do the testing and counselling, to explain to people that they have to take their medication. And very important of all, to tell people that when you come to me, we'll be working on psychosocial issues and I'll be blessing the medication, but we can't mix our medicine and Western medicine until we know where you are and that you're getting better.
Traditional healers have an oral tradition. They don't record things in writing. And so the program had to find tools that are appropriate to their practice. So we developed tools that are pictorial in Zulu, but they may be appropriate for the healthcare centers to understand what is happening. They encourage people to go and test for HIV themselves, and the community believes in them. They trust in them.
Traditional medicine represents the first line of care for the majority of people in sub-Saharan Africa. For this reason, the role of traditional healers in healthcare service delivery in South Africa is of national importance.
We didn't want to see any Pepfar when we started this project because of the history. But now as time goes on, as this HIV was getting into our veins, we started to understand HIV. That is when we say, no, we need more of the Pepfars.
Driving awareness through effective communication is where it all began.
In 2004, South Africa was in a complete state of denial around HIV. We hadn't introduced antiretrovirals. It was a disaster.
We were asked to come into South Africa and to support the South African government to strengthen the prevention interventions using communication approaches.
The first show we did, which was Pepfar funded, which was right at the beginning of the Pepfar emergency funding, called Cha-Cha, where we had an enormous impact on stigma and being able to talk to people about that, you know, it can happen to everyone.
Cha-Cha was one of South Africa's first drama series where we openly tested people on camera and on TV and told the story through a very rural community of the challenges that they were confronting in HIV and AIDS.
Yeah, sabhekelela abo Chisa, abo Cha-Cha, mama drugs abayenzani kuma peer pressure abangani ngimfundisa ukuthi yabona ukuthi makuso wena mele wenze so ukuthi ungagcina ufana no bafana.
The communications people are the people who are in some way strengthening what's happening on the ground. I don't think one could just have a biomedical response to this.
We put in all our vehicles, our television, our print, our radio, information about antiretroviral treatment, and with the help of Pepfar, we managed to reach over 11 million people.
There was no antiretroviral program, and that was such a huge job, you know, to try and get people to, you know, get to know their status and look after themselves without giving them an alternative.
With young people, what we also see is that communication plays a role in reinforcing the behavior.
In and around Johannesburg, a flash stick campaign got people talking. It didn't take long for curiosity to kick in and people to insert the flash sticks into their computers. This is what they saw.
Hi, my name is Martin. You see how easy it was to pick this up? Well, it was the same for me with HIV.
The moment you sleep with somebody, you're not just sleeping with them, you are sleeping with every single person that they have slept with. And Intersections was literally showing that if you sleep with one person, we went back and looked at the person who they had slept with before, and the person they'd slept with before and before and before and before and before. We just looked at the whole chain. We tried to illustrate that idea.
People, they have that mind in the rural areas that people from the urban bring HIV into the rural.
Manda works in Orange Farm for Cadre, the Center for AIDS Development Research and Evaluation.
You can look at intersection at Nomzamo and Zolile from urban to the rural, which it spread like that. What we have seen, the role that Cha-Cha has played, people have changed minds because we do discuss about it in the community and said, what do you think about this? What can we do to do this? So it has a strong impact in our community.
Health communications has also extended to include younger children with programs like Takalani Sesame and its HIV-positive Muppet named Cammy. Another is the acclaimed and highly effective Soul Buddies project.
So we developed a children's series. It was about a group of children, and they did stuff together, protected each other, worked together. And children in South Africa wrote to us and said, please, can't we be a soul buddy? We want to be a soul buddy. So we developed this club concept based at schools. Each club has 20 members. They meet regularly once a week. And we provide materials for them to engage with, all about health, HIV prevention, gender, violence prevention, a whole range of issues. And they do the most fantastic things. These kids are just brilliant.
We regard ourselves as storytellers. What we've done, and I think done quite successfully, is used our storytelling skills to communicate very important ideas around HIV and AIDS.
I tried to tell you so many times, I just couldn't find the right time to do it.
We have what we call a national communication survey, and that was also in partnership with Pepfar partners. So Jahisa, Soul City, Love Life, and now Department of Health. And what I found was much more interesting was what is the impact we are all having together.
Uzandile angeke ayenza ama mistake engwayenzile ukuthola umntwana ngisasemncane uyabona uzofunda aphumelele as long as mina ngizoba i-foundation right for yena uyena uzofika la afuna ukuba khona like ikusasa lakhe lizoqhakaza.
You've got to entertain people before you educate them. You've got to open that door before you actually lead them to a place you need them to go to.
Programs run by Pepfar-supported health communication education partners like Soul City Institute and Johns Hopkins Education have influenced and shaped the lives of millions. With continued expansion of these programs across Africa, the goal of an AIDS-free generation is within reach. In South Africa, despite an enabling policy environment, men who have sex with men, MSM, and transgender individuals often experience discrimination and violence in their daily lives. While these key populations are also vulnerable to HIV infection, they do not always have access to the same HIV services as the general population.
Currently in this country, we have one of the best constitution in the world. No one can disregard the constitution we have, but in terms of practice, there's a disconnection. And the disconnection is, people, LGBTI people experience stigma, experience discrimination in services.
I can remember from the very outset when this secret illness was discovered and people didn't know what it was, and there was a lot of confusion and unfortunately also a lot of sadness because many people died in the process.
People are still quite afraid sometimes to access services from mainstream government clinic services. They feel that they might be humiliated. People also are sometimes victimized in the mainstream public health system.
Very few organizations were trying to address key populations. Fortunately, now the government recognizes that these are very important populations, and in the new National Strategic Plan for HIV, TB, and sexually transmitted infections, it is recognized that we need to bring services to sex workers, to men who have sex with men, and to other vulnerable populations if we're going to have an impact, a broader impact on the general epidemic.
CDC, Pepfar, and USAID, among various delivery partners, work to expand access to non-discriminatory HIV-related services for key populations. Alternative care services have increased to include, amongst others, ICAP, the International Center for AIDS Care and Treatment Programs, its subsidiary OUT, Anova Health for Men, and the MSM Centers of Excellence throughout the country.
Our key populations, especially MSM, does not make use of our healthcare services because of stigma and discrimination and so on. So a huge part of our sensitization of healthcare professionals is then part of our training is to destigmatize.
Whether the person is heterosexual, homosexual, transgender, that is something that I need not to be scared of, because we give them the skills to say, this is how you need to talk about this. These are the kind of examinations what you need to do. These are the other questions that you need to ask, because you cannot make assumptions.
We've managed to be able to accommodate every single individual, whether they're coming from a background where they are black or white, or they're coming from the background where they are in the countries where it's not even easy for them to declare their sexuality.
I want them to be comfortable with me. I want them to interact with me, tell me exactly what happened, this kind of sex they had, this and that, how long ago it happened, the signs, symptoms they have at the moment.
That we recruit peer educators from around the communities in Pretoria, who are then trained on HIV and AIDS-related issues, as well as any other issues which might actually, be faced by the LGBTI community. So what we do after the training is that they go out and serve as the link between our services and the communities.
We've seen in our clinic, for example, we started with this Yeovil clinic in 2012 in March when we launched the clinic. We had such a huge number of clients that come into the clinic. And at that time, we were sitting at around about, 30 to 20% of prevalence of HIV. Within less than 2 years, we've seen a dramatic drop of HIV prevalence and STI.
If I do not engage in the correct manner and in an open kind of environment with a person, I miss an opportunity to assist them with risk reduction. And that's the fight we're fighting.
Because Pepfar has been open, has said we will support funds, we will support programs that access vulnerable groups. Irrespective of sexual orientation, of who you are or where you are, what we want to do is to support people and get access to treatment for all people, because Pepfar has taken that stand. That has been really, I think, important in terms of opening up the debate, particularly around MSM and particularly in sub-Saharan Africa.
So what Pepfar and USAID is doing is, for those who are experts in this field, are provided with resources to support and strengthen what our national government is supposed to be doing, but also to strengthen what the National Strategic Plan is saying.
The South African National Strategic Plan for Health will advance the availability of non-discriminatory support for key population groups, ensuring that no one is left behind in the response to HIV/AIDS. Pepfar has contributed to the improvement of a strengthened health system through multilateral engagement, which is integral to sustaining the response to HIV/AIDS.
I remember thinking at that particular point that we're in big trouble in Africa, because just knowing the dynamics, in particular knowing the conservatism that generally sort of underpinned most of the approaches. The birth of Pepfar and the birth of the Global Fund provided unprecedented resources finally to actually do something meaningful about this.
The demand for treatment far exceeded the capacity to provide treatment. So at government clinics, you would find that there were waiting lists of 3 to 6 months, even longer. And somebody sort of looked at them and said, well, this guy might make it. Let's move him a bit forward on the queue. This guy probably isn't going to make it. Let's just let them die in the queue.
The training of doctors and nurses became key to strengthening health systems.
We train nurses mostly. We train doctors. We train counselors, lay workers. We train people at industries as well, peer educators for industries, and community health workers. BALK is NIMART, which stands for Nurse-Initiated Management of ART. There weren't enough doctors to initiate ART onto patients, so nurses were going to take that over.
We always followed the model of working in partnership with government. We ended up supporting up to 70 clinics with more than 700 seconded staff. And what the trick really was to go in and say, right, what is needed to get patients to flow through the clinics? Because the drugs were there, the clinic physically was normally there, and there was some staff, often the nursing staff and some admin staff, but you were missing a doctor or the pharmacist. So what we would do is really go in, second in the necessary staff, do some renovations if the facility doesn't meet requirements, put in IT systems and project management systems, and in the end supported 350,000 patients on treatment in partnership with government.
As Kitimpilo, our specific focus started off in the management of the individual with HIV. It's not just putting tablets in HIV-positive people's mouths. It's creating systems. It's creating capacity. It's creating a technical knowledge, know-how, and confidence in managing this large epidemic.
And these are tablets that she received. She kept it nicely in a container so that and then she set up the alarm on the phone to remind her for the time to take her ARVs.
The community clinic in Wallerstein is supported by Kete Impilo, a Pepfar partner focusing on health system strengthening. Data management is one of those systems linking community clinics to departments of health.
So every month, records are put into the system and reports are drawn from the system. Monthly reports which will show the new initiations, new patients remaining in care, defaulters for the month, viral loads of patients, and CD4 of patients. So all the information you can be able to get at the end of each month.
Now we have over 400 pharmacist assistants in training. 90 have qualified. So what we have done is we've been able to move them through a career pathing. So from earning $2,000 a month, in 3 years' time earning $14,000 a month through a continuous vocational training strategy.
The funds from Pepfar made it possible that medical people can transfer or shift some of their tasks to other components of the medical team.
We are taking care of HIV, also with TB, and also we are doing a study of pop art where we are starting every HIV patient on ARVs regardless of their CD4 count. It's all about prolonging lives, to improve care and to improve their lifestyle, because the moment the viral load is suppressed, it is more for the patient. It is less infectious to give infection to others.
You know, I can see people being wheeled into clinics with no hope, maybe from their relatives. And after ARVs, having those people bring themselves to the clinics, being well, to me, those are success stories. And the patient coming to say to you, thank you, for their life.
Medical student Francis is practicing at a rural clinic in Worcester in the Western Cape. This includes home visits, which gives these doctors a better understanding of their patients.
Seeing the way that they live, it's so beneficial to our course because you cannot treat a patient properly if you don't know their background. I mean, how can you tell someone to keep their diabetes medication in the fridge if they don't have electricity?
If I am in my home in a village, the way the government would provide services to me would be in a very fragmented fashion. We are changing the way a person is going to experience services from government. It's going to be through one individual who will act as a gatekeeper. That individual then will define your needs, will be trained on 10 critical needs that have been defined by government, and then in one resolution provide these services at the home.
Pepfar's focus on strengthening healthcare services supports the South African government's vision to continue building capacity towards a sustainable national health system for all.
Anglo-American became very involved from the early 90s. We had HIV education advisors who had full-time jobs trying to prevent the epidemic amongst our workforce. Towards the turn of the millennium, up to 25% of our workforce was HIV infected, and they were beginning to get sick and die. And this was a problem for the business. It was so bad that when we looked at key jobs within the business, we had to start training 2 people for the same job so that we would know that if one person got sick, we would have a replacement for that person. And that would be a huge expense to the business.
Well, I think it exploded in the mining industry and has become, I guess, still today one of the biggest areas of influence. I think the prevalence of HIV and TB in the mining industry is more than anywhere else.
In the absence of a vaccine, the Orem Institute was responsible for rolling out what today is known as one of the largest clinical trials, or IPT, ever undertaken. It radically informed what needed to be done to control TB and HIV in the mines.
We did a major study in trying to prevent TB in mine workers using isoniazid. It's a drug we use to prevent tuberculosis. It involved some 80,000 participants in the mining industry, and just getting this work out
and affecting so many lives with what we thought would be a completely life-changing approach to this TB epidemic was in itself something of a major success.
If you're only involved in workplace, then you're actually clapping with one hand. It's workforce community that you have to be involved in.
We really had to respond beyond the workplace. And that was a challenge which even a company the size of Anglo American can't do on its own. We had to find partners who understood what we were doing and were willing to respond to what at the time was an emergency.
For every dollar that Pepfar has given into community work within the workforce community of Glencore Xstrata, they have also given $1. Glencore then joined forces with the Department of Health and said, fine, we will then fund the bricks and mortar to extend clinics, to build new primary healthcare clinics, to build community healthcare clinics, and that's where we started and how the model of public-private mix came forward.
A similar approach by Anglo American has proven extremely successful, where Pepfar, Anglo American, Virgin Unite, and local government partnered to target underserved communities.
For us, it was easy to provide the facility. That was a capital expenditure. But where would we get the money to provide access to the medicines, the laboratory tests, and the staff that would be needed to deliver the service? That's where Pepfar came in. What Anglo American had done with our HIV programs in the workplace, we had shown, because treatment was available, that we were able to scale up testing for HIV, what we call voluntary counseling and testing. And we scaled up those numbers from below 10% right up to 90% of our workforce, checking their HIV status every year. It was an extraordinary initiative, and it suddenly made possible what people had thought was impossible to do. The thing that made it happen was Pepfar. It was an emergency, and Pepfar was the emergency response. It brought funding available to show that it could be done in the most underserved areas.
The launch of the Mom Connect program in Soshanguve, Pretoria, is an example of a public-private partnership with a national impact. Through personalized mobile phone messages sent during and post-pregnancy, the Mom Connect program will ensure mothers pay routine and better attention to their health and that of their babies.
The Mom Connect project is an example of the power of collaboration between public and private sector.
A program like Mom Connect is one in which we're able to leverage the bandwidth and infrastructure of the telecom companies, the financial resources of the U.S. government, the technical assistance that we're providing to the messaging on the program, and really the South African government mobilizing the entire public health system. So it's a great opportunity where development partners like Pepfar, the South African government, and the private sector all come together.
We seeded Breakout Foundation, the implementing partner on the Mom Connect project. And in addition, we provided technical assistance and support to the Department of Health to produce culturally appropriate messaging for the Mom Connect project.
It will send messages to the patient, messages appropriate to their stage of pregnancy. Even after delivery of the baby, it will send messages about the baby, how to take care of a newborn, etc., etc. That's the first thing. The second thing is that the mothers themselves will be able to contact us at no cost to themselves.
Mom Connect is a really, really exciting program and a wonderful opportunity to have a real impact on the lives of ordinary South Africans. And if we can reach 120 million mums and pregnant women, then I think we're making huge strides towards the Millennium Development Goals, but also to making sure that our nation is happier and healthier.
In South Africa, specifically, Johnson & Johnson has a long history of public-private partnerships with the South African government.
We can't achieve this project alone. We can't achieve improvement on outcomes of pregnancy and childbirth alone, starting from our donors to NGOs in the country, which in their own right were trying to do something about pregnancy and childbirth, to the 4 cell phone companies. All of them are partners who are working with us.
The launch of this technology marks a historic moment in South Africa's efforts to fight HIV and improve child health. It represents what is possible with the collective skills and contributions of multiple stakeholders who are brought together to address a very common problem. All three pillars working all together to assure positive outcomes for the next generation.
Ultimately, we have to transfer ownership to government, the government of the country. And we are providing the support that sustains the intervention in the long term.
We've had several successful partnerships with Pepfar, and I think we're united in our goal to really eliminate the transmission of mother-to-child infections in both South Africa and the world globally. So we're really proud of the partnerships that we have with Pepfar, and we hope to continue working with them to have a real impact in the healthcare landscape.
Since 2004, Pepfar has invested $4.2 billion in the prevention and treatment of HIV/AIDS in South Africa, partnering with business, government, and society in response to the pandemic.
It was terrible, and it was really heartbreaking to witness. We could give them preventative help, but we knew the answer was treatment, but there was no treatment available. And it was such a blessing when Pepfar came along with the program. It was, lives were saved. And before that, people were dying. They were leaving young children, orphans. It was like a miracle, to witness it all.
Pepfar put resources on the table, finally, that were at a scale that matched this gargantuan problem and disease that was out there.
If we hadn't intervened when we did, I certainly know that the children of this country would be in a far worse place than they are. We would have even more orphans than we currently have. We would have even more infected children.
It's been the life raft or the life jacket thrown out to a population that was rapidly drowning in AIDS. And we couldn't save everybody, but at least we've saved a lot more than if we'd not had that funding.
People are alive, and you can go and ask them out there in the communities, what has it done for you? You can say, I'm here, I'm alive today because of Pepfar, because of antiretrovirals.
Over the years, obviously, funding has been reduced, and the ultimate aim is to build programs that can transition to government. So government is already starting to subsidize a lot of the services that we offer.
Pepfar is essentially about life. It's about giving life back to people. It's about restoring people's dignity. And it's about helping people to lead the lives that they should lead if there wasn't an HIV epidemic.
So it's a very profound impact that Pepfar has had on the delivery of HIV and TB services throughout all of South Africa.
Despite that earlier delay, when we didn't do what we should have, over the past 5 or 6 years has been absolutely phenomenal. We have the largest ARV program in the world.
The Pepfar billions have made an astonishing and important difference in this whole epidemic, in saving lives and changing people's lives and restoring communities.
Pepfar has allowed us to dream about a better healthcare system. I mean, it's allowed me to do the creative stuff that I think I wouldn't have been able to do otherwise. I think it's allowed us to fiddle with new models. It's allowed us to really go large and to be ambitious.
Thank you for the Pepfar people, what they have done, because they have really touched a lot of lives, and most of the people, they are healthy and they are able to look, and at least we can see the progress.
I think Pepfar brought a necessary light by listening to the voices of the people, by seeing what the problems of the country were.
It is certainly with great thanks and pride that we, have operated and with Pepfar funding.
The key success there is the fact that Pepfar was prepared to partner with us. I think most importantly was the fact that we could ensure sustainability.
So when you say assistance, when you need support,
Pepfar would be there, either with the funds that we required to produce something, either with the technical support that we needed to solve a problem, whether we needed to put in a nurse somewhere or a doctor somewhere. Pepfar has just always been the partner through the story of HIV.
I don't think we'll have done it without the help of our development partners, and Pepfar, of course, amongst them be in the forefront.
Thank you for Pepfar. It saved lives, made a difference, and whenever I can, I like to thank the American people for the contribution that they made to my part of the world here. One can't put a price or a cost to that.
The fact that it's a presidential project, it shows that there is interest in Africa succeeding, not just South Africa, because Pepfar is global. But I think for Africa, it has been a best friend.
Having worked a long time fighting AIDS, I've always looked for what are the interventions that have made the big change? What are the things that have made the difference, that have converted us from despair to hope, have brought life from death? The single biggest intervention in my experience that made the biggest difference was Pepfar.
Working as part of Pepfar, we were able to reach President Obama's ambitious stated goal of treating more than 6 million people, providing more than 4.7 million circumcisions, and giving 1.5 million women treatment to prevent mother-to-child transmission of HIV. That means that last year, somewhere in the world, the 1 millionth baby was born who's not HIV positive because of Pepfar. It's a fantastic legacy.
Pepfar is nothing short of a miracle. It's been incredible to travel in this country from Mpumalanga right through the Cape, and in those programs I see women who were infected, who thought that there would be no way to sustain their family, who are now sustaining communities because of the fact that they're on ARVs. I'm excited by the promise of tomorrow. I'm excited that we're moving closer and closer to an AIDS-free generation here.
South Africa has led in the pandemic long before Pepfar was established. The activism in South Africa has been very powerful and important on the continent. I think the financial contribution is important because it signals to the rest of the continent that there really has to be that partnership between the Global Fund, the host country, and Pepfar in order to be successful.
Since 2012, Pepfar funding has slowly decreased, allowing for increased investment by the South African government. Commitment by the South African government has increased steadily and is projected to reach $1.9 billion by 2017.
Pepfar, partnering for an AIDS-free generation.